Hi
everyone, this is Mary Emma from Superior Physical Therapy. Today I'll be doing a gift of movement video for women who have just had a baby. I've had 2 babies, and one thing I know for sure after you have a baby, everything is really loose. There's 2 reasons that this happens. The first is throughout your pregnancy, your center of gravity is displaced forward, and you get a nice little arch in your back that messes with the mechanics of your spine. And as you get more pregnant, it gets worse. And then also during pregnancy, you have a hormone called relaxin that comes in and makes things even looser by relaxing the ligaments in your body. So to counteract this, after you have a baby, there's a lot of stability that's needed through the low back and the pelvis. I looked it up on Google, and a lot of the exercises are laying down, sucking your stomach in, and tilting the pelvis. And while that's beneficial, it's not very functional. So today I'm going to show you an exercise that you can do that's more functional because new moms have to be on their feet a lot, and they have to bend forward to change diapers and pick up children. So today I'll show you a more functional way to stabilize the low back and the pelvis. So first I'm going to have you start with your hand on a chair or a counter or a wall, something to give you a little bit of stability to begin with. And then all you're going to do is you're going to put weight on one foot, and the other foot's going to go forward and back. And you're going to let your body come forward and back, counteracting the foot. And then after about 10 to 15 of the forward and back, we're going to go side to side. Same idea, your body's going this way and that way to go opposite of your foot. And then the last one is going to be a rotation, forward and back. So that's the beginning version of this exercise. It's best to do it with that belly button sucked in, with giving yourself as much stability as you can to begin with. And then once you get really good at that and you feel very comfortable, you can move the chair, you can move away from the wall, and you can do it without anything, without holding on to anything. You can do forward and back. Be a little more brave with the amount that you move your upper body, side to side, and then rotation. And as you notice yourself getting better at that activity, and you notice that you're having a little bit better stability through the core and through the low back pelvis, you can add different movements with it. You can add your arms into it to give it a little bit to make it a little bit more difficult. So you can do opposite arm leg movement to challenge that core even more and bring in a different element here. And then the side to side would look like this. And then for the rotation, I like to go with my foot. So kind of this way, that way. You can place a weight in your hand, a ball, your child, anything that you want to kind of get a little bit more difficulty into the exercise and progress it from there. So that's my tip for women who have just had a baby, and hope that helps.